you don't have the stool bilirubin, you don't have the recycled bilirubin for urobilinogen either. Okay, so all of these will have the same conjugated bilirubin. All right, the differential then is what's different. In newborns, it's called a choledochal cyst, just a cyst in the biliary tract. That you just go in and surgically remove it, easy. And then biliary atresia. Now, biliary atresia, if you don't fix it, they end up getting bad cancer later in their lives. All right, that's just irritation from bile acids. So biliary atresia means the common bile duct is not connected to a duodenum. And that person's gonna need surgery early in life. In children and adults, pancreatitis. The most common cause of pancreatitis in children, Angie. From in adults, Angie. Gallstones. All right, so anyway, gallstones can do it. Sclerosing cholangitis is part of ulcerative colitis. Remember when you get sclerosing cholangitis with ulcerative colitis, usually it's HLA-B27 positive. Remember reactive arthritis? That's one of the causes. And then it's P-ANCA positive. You guys remember? At that stage. Primary biliary cirrhosis, PBC. This is middle-aged female who's itching a lot. Remember? Bowel salts cause a lot of itching. A lot of itching and scratching. And a lot of fatigue because the liver is failing. Was that lunch? Nice. So primary biliary cirrhosis, if you remember, has anti-mitochondrial antibodies. Anti-mitochondrial antibodies is the best marker for PBC. Any questions on that? Then after age 40, pancreatic cancer. Pancreatic cancer, if you remember from neoplasia, presents as painless jaundice. No pain, but you turn yellow. That's never good. I had one man who had this. Now, pancreatic cancer doesn't really have any good treatment, so I don't believe in pushing anybody to go get treated for something that is not treatable. So they asked me, well, what should I do? I said, go home and get your finances in order. He was dead in 2 months. The reason is 80% of men don't have their finances in order when they die. It's sad. Why? Because the wife is broke right after he died. So now all that money he thought he was putting away for his wife and kids, he forgot to set up a will, forgot to set up all these legal documents. Half that money goes right back to the government. 55% death tax, folks. You die, it costs money. Your husband and wife got to pay to Uncle Sam 55% whatever you were worth. Unless you had it all set up in wills and funds and everything else. That's why the wealthy keep their wealth, because they set it all up in all kinds of trusts. That way government doesn't get anything. All right? And when people don't understand, they don't get it set up, government gets all your money when you 55% of it when you die. Good example. You guys know Sammy Davis Jr.? You guys heard that thing? This man was an entertainer for 60 years on TV, plays, shows, all that. When he died, he didn't have anything set up. His wife had to give almost everything back to the IRS because they didn't have enough cash to pay for the 55%. IRS can take everything you own to get the money. She was back in some little, small apartment in New York. Imagine you're used to living in a huge mansion, butlers, everything taken care of for years. Your husband dies, you're back in a small apartment and broke because Uncle Sam took everything away from her. It's crazy, folks. But anyway, that was the advice I gave him. You can see it worked out because he only had 2 months to get it all set up and he would have died. His wife would have got nothing. It's crazy. But anyway, that's for the men. Make sure you get serious with somebody, get everything set up, folks. It's better to do it early. Men have a tendency to say, oh, I'll live forever. No, you won't. We die before women. So that means you better get everything set up while you're young and healthy. That way, in case something happens to you, all your wealth is taken care of. All right, so after age 40, pancreatic cancer. Stool spends the most time in the ileum in children, sigmoid in adults. That means it pauses for a while. So on the right, the ileocecal valve, pause. Why? It's so that the intestines can fight all the germs. Remember, 70% of your lymphoid tissue is in the ileum. The macrophages, T cells, they eat up all the germs that are in there so that they cannot spread. And then you hold up in the sigmoid. Why? Before it can drop into the rectum for you to defecate. Stools spend so much time in these areas, Zena. That's why you got a lot of transmural pressure, side pressure. Pop, 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 pop. Oh yeah, diverticulosis. More common in the ileum in children, more common in the sigmoid in adults. All of a sudden, folks, all this stuff makes sense to me. Before I used to just memorize it. Diverticulitis, a fecalith got pushed in there. Oh, that's how they get that infection. Yes, that's exactly how they got it. Diverticulitis, more common in ileum in children, more common in the sigmoid in adults. Okay, diverticulitis is the #1 cause of fistula formation in adults. Well, let's say elderly, because it's after age 60. Fistula formation from 20 to 60 is Crohn's. Remember, transmural granulomatous? Eats right through anything nearby. Also volvulus, Mitchell, because the stool is just sitting there. After a while, it gets heavy. And then it can start swinging like this now. But you know it, tight off. Volvulus, more common in ileum in children, more common in sigmoid in adults. And then intussusception. If the stool is sitting there for too long, Halima, it makes that bowel get swollen. And then it starts sliding ahead like that. And that's how you get intussusception. Give me a buzzword that goes with intussusception, Miguel. Heard me say him before. All right, Amy. You're angelic stools, Steve. Telescoping, Oxane. Sausage-shaped mass. All right, very good. Remember, we talked about it in HSP because that's their complication. All right, so now you know. What do we do for it? Air contrast enema on them. Then you see the telescoping, and you use the pressure of the air to push it back out of there. What's the leading edge for children on them? Do you remember this? What's pulling? That means what's pulling? Leading edge in children. Yeah, leading edge for children is usually a polyp. Occasionally, second is lymph nodes, because you got so many of them in the ileum. And occasionally, Meckel's. For adults, it's usually cancer. So you see, by knowing that, I know you got to do colonoscopy after you reduce it. You have to rule out colon cancer. Any questions on that? Okay. The appendix is the last part of your small bowel. The appendix is the last part of your small bowel before you enter the colon. This organ is now thought to be used to replenish your normal flora. How did they figure this one out? Remember, for years, they thought appendix has no use. That's why a surgeon is allowed to take off 15 to 20% normal appendices to not miss one appendicitis. Everybody understand that? All right. So that means with appendicitis, if you think about it, we're going to operating room. Remember that. Because even if you're wrong, no problem. You're allowed to take it out. They don't want to miss one in the child. Why? If you let that thing explode in a child, a lot will die. So that's why they say, don't take any chances. If you think about it, go to operating room. The surgeon is happy to come in at 3 o'clock in the morning and do it. Why? Because he knows he's protected. If you're wrong, nothing. Nothing is done to him. He just take it out, still get paid for the procedure. Okay, but no harm done. All right, the appendix. The way they figured this out is people who had C. diff. Somebody did a nice retrospective study and found out that and saw a big connection. If you still have your appendix, you recover from C. diff much faster. The ones who had appendectomies in the past took a long time to recover. So that's why the thought is your normal flora, which obviously concentrates in the appendix, it crawls out if you lose it. But if you don't have appendix, there's no normal flora to replenishment. So appendicitis. Most common cause, fecalith. They get what we call, what's the word? Visceral pain first. Visceral pain is referred pain. Your appendix is T10. That's the same level as your umbilicus. That's why the kid always said my belly button hurts by me. And then all of a sudden, yeah, straight to the right lower quadrant. That's called McBurney's point. McBurney's point. That's somatic pain. They love asking that. Visceral pain before somatic pain. because the student has to know what that means in order to get it right. 30% will perforate in the first 24 hours, which is why they say, if you even think about it, go to operating room. Because you're also preventing those 30% that would have perforated. All right, so appendix. The appendix is where the majority of carcinoids are found. But if you remember, the carcinoids in the appendix do not metastasize, so they do not cause carcinoid syndrome. That's the trick question they like to ask. If you have carcinoid syndrome, it didn't come in the appendix. It came from the pancreas first, ileum second. Trick question. They know you know appendix has majority of carcinoids, but that's not where they metastasize from. Pancreas first, ileum second. All right, that's appendix. There's appendicitis, everything we just talked about. It gives a pain around the umbilicus, visceral pain, and cells the right lower quadrant of Brenner's point, that's called somatic pain. Fecal length is the most common cause. Management, just like every other abdominal pain. What's the first thing you do, Maria? MPO first. MPO. Yeah, in case I gotta take you to surgery, don't forget that. MPO, then your normal saline, then nasogastric tube to decompress the gas so they don't perforate, then meperidine for the pain in case it's gallstones, and then abdominal x-ray. If they want to test, because remember, you can go to surgery on clinical grounds alone. If they want to test, they like ultrasound in children, there's no radiation, no harm, and CT scan in adults. Okay? For confirmation, yeah. So if I see a question where they want confirmation, that's what they want you to be. CT scan in adults. If it's a child, they want ultrasound. Don't do CT scan on a child. Anna. Nothing fancy you see in ultrasound. You just see inflammation. That means the wall is swollen and thick. That's it. Yep. Cecum, the first part of your colon, is also the largest part of your colon. And that's why cecal cancer is poor prognosis, which is the question they like to ask. Why does it have poor prognosis? Because this thing is so big that it never presents as an obstruction. It presents as iron deficiency anemia, which is why we're always doing rectal exams every year after age 40. That's when you're going to see it. Because if you wait for obstruction, the patient will be dead by that time. Cecum is where pinworms like to hang out. We'll talk about that next week. Pinworms, they love to ask that. Where do pinworms like to actually infect? They like to hang on the cecum. They just come out in the anus at night to lay their eggs. So all that anal itching that you get is just when it came out last night to lay their eggs. It's the eggs that cause the itching. Cecum. Any questions on cecum? Mabel, you have a question?
Yes. So what do you call it? It says what it says pinwall.
No, pinworms. Pinworms.
Okay, pinworms. Okay.
Yeah, pinworms.
Okay, they come from the cecum, right?
That's where they live. They don't come from there. They live there.
Oh, free. They live free there. Okay.
Boy, she's the other one that has her claim. I got a thick accent. I told you to beat out of me on the south side of Chicago. I ain't got no accent left. But she still hears us accent. Anyway, so ascending colon. Ascending colon is your last chance to reabsorb fluids and electrolytes. Ascending colon, Justin. Your last chance to reabsorb fluids and electrolytes. So along the ascending colon, you got millions of sodium potassium ATPases controlled by what hormone? You want to reabsorb fluids and electrolytes. Aldosterone controls it. So if you activate sodium potassium pumps and you're reabsorbing sodium in exchange for potassium, that sodium then drags your membrane 3 times its weight in water. Is your stool going to become harder or softer? Harder, which means the #1 GI problem in America is what? Constipation, because 9 out of 10 Americans don't drink enough water. So aldosterone. What's the second measure for aldosterone, Karis? Oh, yeah, that's right. Oh, okay. Now you're flexing on me, baby. I love that. See now, all right. See now you see the tricks. I told you. See, before they would have caught you, now it's like, oh, come on, I know this trick. That's what I'm telling you. I wanted to become that crazy for you guys. So that when you get to a question, oh, I know this. Oh, I know this. All of a sudden you go through a whole bunch of questions and taking like 3 seconds, you already know the answer. That's because you know the clue and you're familiar with the question. I told you the content of the test does not change. They just find another way to ask you the same thing again. They just pick a different story at home and ask you the same question. All right, so A semicolon, your last chance to reabsorb water electrolytes. All right, transverse colon. Nothing going on here. So after A semicolon, folks, everything left over is trash. So transverse colon, we have words for primary and secondary peristalsis. In the colon, primary peristalsis is called haustration. So remember, colon has haustra, which is thicker than segments, the little tiny lines. But this way, when they use the word haustration, you know exactly where they're at. They're in the colon. Mass movement, fecal mass, obviously, is the term for secondary peristalsis. But that way you know they're in the colon. And you look carefully, which answers are in the colon before you worry about the details. It always eliminates 2 or 3 answers for me, okay? Watershed area for the transverse colon, remember splenic flexure. Rectus sigmoid is later. Any questions so far? We're just going through the colon, pushing things along. So here we are, Halima, descending colon. All you got is haustration, mass movement again, primary and secondary peristalsis. And then colon. In the adult, stool must sit in the colon for a while. Your colon sits at a 90-degree angle with the descending colon and rectum. All right, so let's see if I can illustrate this for you. I don't know if the people online are going to be able to see this at all. Oh yeah, yes they can. Yeah, turn the side. So here's your colon, like your sigmoid, like this. Right, see that? And then my hand is your rectum. See that? 90-degree angle and 90-degree angle. This rectum is plastered up against your anterior abdominal wall by the muscle called pubococcygeus. It holds it at a 90-degree angle. That's why the stool in the sigmoid just sits there for a while, because there's no gravitational push to get out of there. That means, folks, in order to defecate, you have to first relax your rectum like that. That means you have to relax the pubococcygeus muscle. Then this falls in line. Aha, gravity. See that? Now it starts pushing everything down. Okay? Let's go through the whole process. Relax pubococcygeus muscle. Rectum falls in line with the sigmoid colon. Now gravity will push the stool down. Once stool touches the internal inner sphincter, that's your first urge to defecate. That's why, let's say if you're talking to somebody and stool hits your internal inner sphincter. That's how I know. And that's how you know. Because somebody is up and you just see it. Okay. Now with kids, oh, kids are the funniest. Because kids, when they're having fun, they don't want to go in. They want to stay playing with their friends. Whatever game they're playing, they want to stay right there playing. Okay? So you see them doing that. And then, yeah. Well, that's the first call, folks. You got one more call. One stool overcomes that sphincter and touches the external anal sphincter. That's your last urge to defecate. Now, this is what you see in kids, because the first one, like that, they just kind of tighten up a little bit. And then when it hits the exit, you see them put their hand like that. So funny, because they put their, because they're trying to hold it in there before it falls out. And then they run to the floor. Well, there's a disease. Well, it's not really, it is disease, psychological disease. It's called encopresis. Children holding onto their stool is a habit. So the stool becomes so hard because they've held onto it for so long. Now you got a column of a brick of stool sitting in there. Every time they try to go to, oh, it hurts so bad, they push it right back in. I'm serious. And then they hold on to it again. As you see, it just gets worse and worse. I remember when I worked with gastroenterologists, we had a bunch of these. I had no idea it was this common. But there's a lot of kids who just want to keep having fun, who don't go to the toilet. So you have to teach the parents. And when they're playing outside the yard, just watch them. If you see them doing that thing, there, oh, tell them, Johnny, go to the bathroom, go to the bathroom, go back. No, I don't want to do it. Go to the bathroom right now. And that kid will go to the bathroom and defecate. But he was trying to hold on to it because he was going to have fun with his friends. The girls are even better at this. The girls will squat down on the ground so that the heel of their foot pushes up against the anus. And therefore holds the stool forever. And that way they can keep playing with their friend, but that stool is getting drier and drier and drier. Anyway, we call that encopresis. So you got to use good laxatives to try to get that out of there. So what do? I learned this from the gastroenterologist. First, you lubricate the bowel. The best one is mineral oil. It's the most benign oil. In case they aspirate something, we're not worried about it. Mineral oil just goes all the way down the intestine, coat the whole thing. All of a sudden, that brick of stool starts sliding down. See that? Because it hurts them so much to defecate, because that brick of stool is stuck to the sides of the colon. That's why they don't want to defecate anymore. And it gets worse and worse. And sometimes they'll get fecal incontinence. The liquid stool above it will keep squirting around it, and they keep having stool in their pants. And the parents don't know it's because of the constipation it's doing. Huh? Oh, this is over weeks to months. Yeah, this is. Oh, yes, they'll hold on to it months. The stool will be there. Yes. The most severe cases, we have to take them to surgery. You have to cut open the colon and sigmoid, get all that stool out of there. Otherwise, they can't move it. It's been there for so long, it's stuck. I mean, luckily, all the ones we saw. Anyway, let me just go to routine I always do. Mineral oil to lubricate everything. And the best one now is Miralax. Miralax has got this chemical, almost like magnesium. So magnesia is the second best one. Just pulls water in gently. And that water then mixes with the stool, and all of a sudden the stool starts getting softened up, and therefore parents also push it right out. And I've never had a child not respond. I learned it from a gastroenterologist. It works every time. Either milk of magnesia or Miralax. Clean right out. Yes. Polyethylene glycol. That's it. That's the chemical in Miralax. It's just an osmotic agent. Pulls water. Huh? Oh yeah, better than glucose. Oh yeah. A lot of articles about Miralax. The parents don't even realize these kids are doing it. Yes. Excuse me? Yeah, it's not like the kids ever tell the mom. The kids just stop it. And the kid, every time he goes to the bathroom, it hurts so bad, they just pull it back in and don't defecate. They still don't say anything to mom because they think mom's gonna be mad at them. And it's not until all of a sudden their belly is aching so bad that mom feels this brick in there, and all of a sudden you go to the pediatrician, we're like, oh my God, this is encopresis. Then you send him to the gastroenterologist. And then he does his routine. And that was a routine I use and it works. All right, Ashley.
My brother
Uh-huh. Yeah. 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 Yeah.
But doctor actually told her to just let him go behind the couch and do it. It was like so bad. It was
Yeah.
sick.
Yeah, because you got to get that first break to get out of there. That's the hardest one, folks. It hurts them so bad that they just hold off going. So this is why it takes a special parent to say, okay, we got to get this kid to go. Now, I don't tell them go behind the damn couch. But what I do, I told you, I use either milk or magnesia, 2 ounces every 2 hours until they go. That sucker, whoosh, I'm telling you, it works. Okay? Or Miralax. Drink a glass of this twice a day. Man, I'm telling you, within a day or two, they're gone. It pulls water in, softens up the stool, sliding right out. And because you got the whole thing lubricated, yeah. All right, anyway, the term is encopresis. All right, so once stool touches, where are we? External anal sphincter, okay. Relaxation of pelvic floor muscles is what you got to do. And that relaxes the external anal sphincter, and then you go to the bathroom. That means, folks, defecation is a true science. Oh, what a joy.
Oh.
Now, do you know that somebody had to figure out the approximate angle? You have to spread your butt cheeks This is science, folks. We're dedicated to our craft here. All right, so somebody was spreading everybody's butt cheeks. So they figured out what angle you need to relax the pubic muscle and the external anal sphincter. It was a Standard Oil company. And of course, now they've sold out to BP, right? BP. And it was, yes, it was the toilet seat, folks. There's science that toilet seat you guys are sitting on. It's not flat, is it? No, it's curved in slightly. I think it's 27 degrees. Isn't that amazing? But I was amazed when I read that, I don't know how many decades ago. But it's like somebody was experimenting with this and found out, yeah, you need to part your cheeks just right. And all of a sudden the two muscles relax. And that's why you can sit on the toilet, and that's why you defecate with no problem. Try going in Asia or Africa where there's no toilet seats in the outhouse. How come you gotta push so hard? Oh yeah, now. You gotta push. And then somebody outside said, nah, 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 nah. Nah, nah. Then you make a hit record out of it. I'm sorry, I get flashbacks, I'm sorry. That was an old song from way back, man. All right, but anyway, it was Master P made that one. But anyway, 27-degree angle. I remember it's a Standard Oil company who came up with it, and that's why every toilet seat, has a slight angle to it. That's not by chance. They didn't just randomly put that slant to it. There's a certain slant they put in there. Both muscles relax, you defecate with no pain. Whereas if you go to other countries where they have either a hole in the ground, like in Asia, or you got an outhouse, or you just partying out in the bushes, you're gonna have to push a lot harder because you don't have that science behind you anymore. Just think about it. Okay. Excuse me? It depends on how you squat. Yeah, it depends on how you squat. Now, look at this, folks. There is no sympathetic input to defecation. None. The only sympathetic places are the two sphincters, but you have to relax both of them in order to defecate. So there's absolutely no sympathetic input to defecation. That's why if you're stressed out, Jess, what's the first discharge out of your brain? Parasympathetic. That's why when somebody scares you real quickly, you almost poop in your pants. See that? Because parasympathetic was first, and there was no sympathetic input at the time. Guess what? All sphincters are wide open. Yeah, think about it. Any questions on that? How about if I do? Oh, Melissa, go ahead. Wait a minute. Off about what now? Your whole cycle?
Yeah.
Oh, that's because of pineal gland. So the question is, why is it when you travel, your whole cycle is off? That's the pineal gland. So remember, pineal gland controls all circadian rhythms, but the pineal gland responds to light. If you go across time zones, the light changes every time you cross another time zone. Right, follow? Every time the pineal gland gets confused by what just happened, because every time the light changes, he's like, what's going on? Anytime he gets confused, he shuts down for 2 to 3 days. That's exactly what you're talking about. And all of a sudden, every cycle is crazy for 2 to 3 days. That's called jet lag. That's why you jet lag for a couple of days. As the pineal gland is shut down. So nothing's working quite right. That's why you just don't feel energetic. All of a sudden, by the 3rd day, you got all your energy back again. Yes, sir. Oh, how do you prevent jet lag? You want to prevent it next time, Melissa? All you do is whenever you're traveling across time zones, wear a thing over your eye patch, fall asleep. Your eyes can't see the light change. No jet lag when you get there. That's why they give it on airplane. Because when I go to Nigeria, I'm going through a bunch of time zones, but I fall asleep. I eat a big dinner, all the blood's like, I'm gone. That's it. I'm gone. That way, when I wake up, we're there. And I didn't see any time zone change. I'm energetic when I get there. Before, I didn't know that. I would, you try to stay awake. You don't realize you're seeing the light change. And then when you get there, like, oh, man, you're just wiped out. Like, geez, oh. And you're like, did we run a marathon in the plane? I don't know. What's going on? You have no energy at all. Okay? Yes.
Also, like 1 dose of Ambien for the patient if they have like a big conference.
1 dose of Ambien. She says you can just take Ambien.
One night.
Yeah. She likes the pharmaceutical route. Take an Ambien. What? That works. Yeah, Benadryl. Just a big old helping of Chinese food works for me. Now, I'm telling you, that's just me. I love Chinese. I just need a big old helping right before we get on the plane. We usually board about 3:30. Man, I eat that right there in the airport. I like, give me a big helping of that, add that. Okay, give me a soda. And then I just eat that as soon as I get on the plane. I'm out. And the next morning I wake up, oh man, we're descending for landing, like 13 hours later. I was like, oh man, that was pretty good. That was a good flight. Yeah, but everybody else is wiped out. I'm like, hey, I feel good, man. Let's go. It works, folks. It really does. All right. Hang on. No more questions for a second. I'm going to show you guys how to absorb everything in 30 seconds or less. Get ready. Here goes. Sugars, 10% of duodenum, 90% jejunum. Amino acids, 10% duodenum, 90% jejunum. Fats, 10, 80, 10. A, D, E, K, B12, 100 in the ileum. Iron, 90% duodenum. This is the only time you have to flip everything around. Iron, 90% duodenum, 10% jejunum. And then everything else, I don't care what it is, they ask you 10, 90. Which part of the GI tract has the greatest absorptive surface? Chris. I bet you can figure it out. No, don't hesitate. Whatever you thought, that's the answer. Yeah. What? What did you do? It has 100% of fat soluble vitamins. That's it. Let's ask Matt. Which part of the GI tract has the greatest absorptive area? Jejunum is absorbing 90% of everything, Chris. You see what I'm saying? Yeah, you look real good. So there's a way to figure it out. Okay, the absorption. Remember Fick's equation I told you guys that apply to every member in your body. I started reading some chapters, and I happened to, again, my brain catches patterns at that time. I saw 10%, 90%. I saw the three things. I said, wait a minute. I wonder if the pattern is just 10%, 90%, because that means the jejunum's got to have the highest surface area. I looked it up, highest surface area. I looked it up, thinnest wall. I looked it up, highest concentration gradient. Sound familiar to anybody? Everything I told you about Fick's equation applied to the jejunum. I said, I knew it. See, once I connected that date, never had to look it up again. That means I don't care what they ask about, selenium. I mean, they always pick some weird vitamin or something you never heard of. And ask you, where are you going to absorb most of it? Folks, there it is right there. Just click the jejunum and call it a day. Because you'll really be wrong. Now, let's make this clinical.
Excuse me, sir.
Who's speaking? Oh, Muhammad, go ahead.
Yes, sir. Sir, what is IF?
Intrinsic factor.
Okay, thank you.
So now, let me make this clinical. Whenever you get gastroenteritis, with parasites especially, okay, most of them infect your duodenum. Why do they infect your duodenum? Because they want to eat the food before you get to it. They're no fools. They got on Google. Google says all the food comes to duodenum first. So most cause of gastritis right here. All of a sudden, look at that, iron. I realize why all of them cause iron deficiency anemia if you have it long enough. Suddenly, I never had to look that up again. Every parasite, every cause of gastritis, if you have it more than a few days, you end up with iron deficiency anemia. Now you know exactly why. Next, when people have gastroenteritis, we're going to be talking about a lot of them next week. Most of them I'll never mention. You need to treat it. Why? You can make up 10%, not a big deal. Why do you think we say don't treat it? Because the drug is worse than the disease. You're only losing 10% of any nutrient. That's what I say. Drink some Gatorade, Pedialyte, you'll be fine. Because 10% is not a big deal. How about Campylobacter jejuni? How come they say you need to treat it? See that? That's something, again, if you don't see the pattern, you'll never know why they say treat that one, but don't treat the other ones. Because how do you make up 90% of losses? You can't. You can't eat enough to make up 90% of losses. If you got jejuni, just shedding the jejunum, you can't absorb anything. That kid is going to be malnourished. That's why they say treat it. Think about Crohn's. Crohn's starts in the ileum. That's only messing with fat soluble vitamins. Once Crohn's affects your jejunum, you start dying real quick. Now you know why. Think about celiac sprue. It affects jejunum and sometimes duodenum. Why is that such a severe disease? Why does that cut a child's life real short when they get it. Now you know, because you mess with 90% of everything. There's no way that kid can eat fast enough to make up for all that. Yes, sir. They die of heart failure because of vitamin deficiency. That's correct, sir. See that? It just, so much doesn't make sense. Okay, so much doesn't make sense. Fats, higher vitamins, all the ileum problems. So Whipple's disease, tropical sprue, because they affect the ileum. You know, that's why you got a problem with A, D, E, K, and B12. Okay, but this way, based on what clues they give me, I can figure out exactly where in the GI the disease is occurring. That's why I'm giving you this chart. It's helped me for many years. Okay, 1 or 2 clues, I can already tell you what disease it is because I know exactly what part of the bowel they're talking about. But when you don't see it like this, you see, you're still drowning, trying to figure out what disease you're talking about. There's clues, folks. Okay, and this is very helpful. All right, the rest is pharmacology. Anybody ready? Everybody ready? Everybody?
Excuse, sir.
Yes, Mabel.
Please, sir, what do you say about sugar and protein? Is it protein?
What sugar and what protein are you talking about? We
You
did
said that
sugar a long time ago. What are you talking about?
So you said that. What do you say about sugar and amino acid in
No, right here. Wait, Mabel, this is how it's absorbed in the small intestine. 10% of duodenum, 90% jejunum. It's all right here for you.
Okay. So what happened? What happened if sugar and amino acid is absorbed 90% in the duodenum? What disease do we have?
So it's 10% in the duodenum. I just said all your gastroenteritis cases, parasitic infections, they all start in the duodenum.
Okay.
That's why you lose so much iron, but you don't lose that much nutrient. That's why we don't treat it.
Okay.
All right. Whereas if you get an infection of jejunum, we treat them all because you're messing with 90% of my nutrition. And that's why those are the worst diseases. That's why celiac sprue, those kids don't live so long. Okay, when Crohn's affects jejunum, they start dying pretty fast. Okay, just understand it. Your jejunum is your best part of the small intestine. All right, pharmacology, here we go. I'm just going through the diseases that we talked about, just so you know how I've got it organized. So from gastritis all the way through, all right? Gastritis, calcium carbonate, that's Tums. The carbonate buffers the acid, but the calcium is a second messenger for what hormone, Terrence? Calcium is the second messenger for a hormone by itself. Not no epinephrine, gastrin. Now look at the problem here. Tums was the first antacid to hit the market. The company accidentally put the carbonate with calcium as a salt, not realizing calcium is the second messenger for gastrin. You're actually keeping the ulcer going. They didn't know that. That's why they repackaged their stuff. They put on there, if not better in 2 weeks, please see your doctor. You know why they did that? That way now it's the doctor's fault. That's called $1,000 an hour attorney. Yeah, put on the packet. Yeah, see your doctor. That was his fault now if they burn a hole in their stomach. Because otherwise, people used to eat Tums like it was candy. Because they thought, yeah, just put carbonate. Because your ulcer feels good right away. As soon as it contacts it, absorbs the acid, you feel better. Think about farmers. They drink buttermilk out in the field. They don't go see the doctor. So years ago, so many of them were coming with perforated ulcers because they've been drinking buttermilk the whole time. Well, buttermilk, milk has calcium and has carbonate in it. There it is. Same thing. And so they call it milk alkali syndrome. Ring a bell? That's exactly what it is. Now we see milk alkali syndrome, people on thiazide. Remember? Thiazide causes hypercalcemia. So now all of a sudden, thiazide is causing ulcers. It was just an oversight. It's just something you need to know. It can happen. All right, anyway, that's calcium carbonate. Next one, aluminum hydroxide, Rolaids. So anyway, calcium causes diarrhea. Remember, second messenger. IP3 diet, calcium carbohydrate, calcium plays a role. Aluminum hydroxide. Hydroxide buffers the acid. Aluminum causes constipation. The opposite. Magnesium hydroxide. Hydroxide buffers the acid. Magnesium causes diarrhea. So you want to know the side effect of each one. Gaviscon is a topical base. It just coats the ulcer for you, you feel better. Sucralfate, same thing. Sucralfate dissolves within the ulcer. You can actually use it to diagnose an ulcer. Because a lot of people forget children get ulcers. They get stressed just like anybody else. So if I think a child has an ulcer, I say, Mom, I want you to give him some of this sucralfate. And I'm going to call you, or I'll tell her, call me tonight, tell me how he feels. And like after 2 doses, the kid said, oh, the pain is all gone. I said, oh, good, it was an ulcer. Then I said, okay, take this for another month. Okay, because the sucralfate only dissolves into an ulcer. It doesn't do anything else. If there's no ulcer, you pull it right back out. It's non-absorbable, so you never have to worry about any systemic side effects. So sucralfate. Bismuth, Pepto-Bismol. Bismuth suffocates H. pylori. And we already said 95% of the time with duodenal ulcers, 70% of the time with gastric ulcers. So it kills H. pylori for you. And then the gastritis heals up. Bismuth. H2 blockers. Our first line for gastritis or gastric and peptic duodenal ulcers. H2 blockers block about 70% of the acid output in your stomach. What do you need the acid output in your stomach for, Zena? What's that for? For GERD? We cause our own GERD? I know you remember somewhere else. Come back, come on. All right. Why do we need acid in our stomach? Steve, what's that for? To digest what primarily? Proteins, fats, and sugars. Proteins. So that means if I block 70% of your acid output, you cannot digest 70% of your protein. Side effect: nausea, vomiting, gas, bloating, diarrhea. Why? Because you cannot digest it. Just sitting there, and eventually, when food sits in yourself for too long, that's what causes a headache. All right, so nausea, vomiting, headache. So that means you got to warn a person. You can't go to Old Country Buffet. A lot of physicians don't warn a patient. You can't do that. Did you know that's the number one reason for stopping these drugs? Nobody told them. They went to a buffet. You go to a buffet, you pig out, right? And they have such severe aches, they end up in the emergency room. And all of a sudden they stop the drug. They think the drug did it to them. They don't realize it's the food that did it to them because they ate too much. You can't eat your normal meal when I'm cutting down 70% of the acid in your stomach. So what's the recommendation? Eat small meals. Eat like 7 small meals a day. That's how you do it. Cut it way down. Okay? The only one with a clue, cimetidine blocks B450. What effect does that have on warfarin? Justin. Levels will go up or down. It goes up. Yeah, so he just recommended to cut down their dose. So that's the only one with a clue. All right, question. Aluminum hydroxide causes constipation. Okay. Proton pump inhibitors used when the symptoms are more severe because they block 90% of your acid output, which means the side effects are even more severe with these guys if you go to Old Country Buffet. Oh yeah, I remember hearing about some bad cases, man. I mean, just rip your stomach because all that food you just ate is going to sit there for a long time because you only got 10% acid output. One thing you got to know about proton pumps: the proton pumps pop out every morning, and then anchor to the mucosa like that. That drug has to be in the stomach half an hour before the pumps come out. That means it's already waiting on the mucosa. So when the pump comes out like that, right before it anchors, the drug grabs it like that and will not let it anchor. The pumps only pop out once a day. So that means if you stop it in the morning, guess what? No more pumps for the rest of the day. That's why 90% of the acid you can put is gone. You can't make it anymore. Isn't that amazing? They have to be taken half an hour before your first meal. Because if you don't, that's it. Once those pumps anchor, the drug can't do a thing about it. So again, it's the doctor's got to understand it so you get the right instructions. Otherwise, if they take it after the meal or during the meal, it's too late. The pump is anchored. Too late. Your drug is no good. Okay? It has to be there before. And that way, as soon as they start to anchor, the drug grabs them and says, no, you cannot anchor. That's it. No more pumps for the rest of the day. Yes.
So it has to be half an hour.
Half an hour before breakfast. It's the best time to take it. Yep. And otherwise, none of them have any specific clues. Next one. Simethicone is used to dissolve gas. What's the main gas in your intestines, by the way? Arsenic. Carbon dioxide. So simethicone just reacts with carbon dioxide. That's all it does. And therefore the gas disappears. Loperamide diphenoxylate, remember you saw it when we did opiates. These are opiates for severe diarrhea if you're traveling. I said if you get caught in the Amazon or somewhere with dysentery, you ain't gonna make it back. Because the diarrhea is so severe, they won't be able to get you back to town to give you an IV. So that's why you need to know how to stop your bowels from moving. And that's what we do with that. Loperamide, diphenoxylate, that's Imodium and Lamodal. If you remember, opiates have the most sedating effect on smooth muscle. Psyllium, Metamucil. Psyllium is a non-absorbable sugar. Of course, sugar pulls water. It's beta 1,4 bonds. You and I have alpha 1,4. So beta 1,4, we cannot digest it. And therefore, it just keeps pulling water into the stool to soften it for you. Main side effect, gas. CO2 gas, just like Krebs cycle or any other cycle produces from sugar. Gas. Yes, Adam. Yeah, that's why you eat green vegetables, because the cellulose is not absorbing sugar. Yeah, that's why green vegetables and fruits clean you out. Yeah. That's psyllium. Sorbitol, you get it from green vegetables and fruits. That's why those are the ones that clean you out the best. You know, broccoli, green beans, and sorbitol. Sorbitol, as you know, is a breakdown product of glucose. We've talked about it many times. And what's the enzyme that produces it, Gloria? Aldose reductase, and then sorbitol dehydrogenase can't handle it too much. So sorbitol cannot cross membranes. That's how it causes neuropathy. When it happens in your neurons, it can't go anywhere. So here, it happens in your GI tract, it just clean you right out. Keep pulling water. Mag citrate, okay, magnesium, 2+, pulls water. That's all you're doing. Just like milk and magnesium, just pulling water in. Phenolphthalein, it's found in X-Lax. Turns your colon black. So in people with anorexia and bulimia, that's how we knew they were abusing X-Lax a lot. You get what we call melanosis coli. When we scoped them, jet black colon, just black. And it was this chemical, phenolphthalein. Turns the entire colon black. Yes. Yeah. Yeah. Bismuth will turn it black, but nowhere as much as phenolphthalein does. Yeah. Decusate sodium, Docalax, is a gentle intestinal stimulant. That means it just starts peristalsis to going. Obviously, you want to drink a lot of water, and then the Docalax, and then where peristalsis will begin and push everything out. Mineral oil is the safest oil used to lubricate the bowel. For like encopresis that I talked about, or elderly people with severe constipation, mineral oil works real well for them too. It's just the most benign in case anybody aspirates it. We don't have to worry about them choking and suffocating on it. Cisapride, we talked about. Serotonin agonist. Used to treat GERD. It was called propulsive. So 90% of the ganglion, serotonin ganglion is in the GI tract. So it moves the bowels even better than acetylcholine does. All right. So if I can stimulate peristalsis in your stomach, that means all the acid goes forward. That means hardly anything to reflux, and it worked very well until they found out it blocks P450, and a bunch of people died because it prolonged the QT interval and killed too many of them. So it finally got taken off the market. So prolonged QT interval. So how does cisapride prolong your QT interval, Lillian? By blocking what? How'd you know that? Just say, I read. That's what you do when the attending is shocked that you knew stuff like that. Remember, anytime they ask you, just say potassium every time. Don't even think about it for 2 seconds. Just say the same thing. All right, anyway, that's cisapride. Metoclopramide is a dopamine blocker and a serotonin agonist. So again, it did just like cisapride. It's used for GERD, okay? But it also blocks dopamine. That was the bad side. Too many cases of Parkinson's from this drug. In fact, it causes the most Parkinson's cases caused by drugs. You would think the antipsychotics would cause it more, but this one caused it more than the antipsychotics did. And that's why it's hardly used, but it's still used every now and then for GI problems. All right, sulfasalazine and sulfapyrazone are salicylates, like aspirin. Use them for ulcerative colitis. Remember, you got inflammation, inflammatory bowel, you need an anti-inflammatory in there. Sulfasalazine is first line. Why is that? Look at this. When this thing gets down to your bowel, all the way down to your colon, the bacteria will split this bond right here. Sulfa drug will kill the bacteria. They commit suicide. And then salazine is let's say, treats the inflammation. That way you're killing the bacteria and you're treating inflammation at the same time. That's why he's the first line drug. Yeah, that's all it is, sulfasalazine. And then salazine is metabolized to mesalamine, which is another salicylate, mesalamine, for ulcerative colitis. Yeah, so that's why he's first line, because you're getting 2 salicylates for the price of 1. Sulfapyrazone is second line because you don't have that mesalamine production, just sulfa and then pyrazone. GI pathology, buzzwords, here we go. A-beta-lipoproteinemia means B48 is not there. It's genetic. How do I know that? Beta-lipoprotein, wait a minute. Let me see. Beta-lipoprotein, no, that's not the way I want to say it. Apoprotein, yeah, apoprotein B48. It's used to make which, so I guess right, carrier, yes. Mabel, B48 is used to make what? Triglyceride carrier.
I say what?
Apoprotein B48 is used to make which triglyceride carrier?
B48.
Yep. Now let me ask Leslie.
Chylomicrons?
Yeah, chylomicrons. So the best clue is they have no chylomicrons. Remember, if you don't have B48, you can't make chylomicron. That's the best clue you're ever going to get. Okay? Because all of them are going to cause malabsorption because now you can't absorb fats. All of them have steatorrhea. They can't help me. All of them have all the fat soluble vitamin deficiencies because you don't have the fats. All of them have trouble with all the steroid hormones. What do you need? Because you need fats to make all of them. So just so you know, pay attention when I give you these keywords, folks. Otherwise, you're going to be drawing it along forget. And you still won't know which one they're talking about. It's all the same if you miss the keywords. Okay? All right. So that's the key piece of information. No chylomicrons. Next one. Ataxia-telangiectasia. Remember, we met him like 3 times already. First clue. They have spider veins all over their body. That's the biggest feature. Telangiectasia, 95% of them have it. So to describe spider veins all over their body. Second, they have IgA deficiency. So it shows up on the immunodeficiency for next week. Third, they have malabsorption, which is how they became neurological. Because malabsorption of fats, then you can't make myelin, and that's how they get neurological problems. Ataxia is because they demyelinate their own cerebellum. So it shows up in GI, and it shows up in neuro. We'll see him again in neuro. We'll see him in micro next week. So ataxia-telangiectasia everywhere. We first saw him in DNA RNA. What was the problem? DNA breakage repair. Remember, you cannot replace the nucleotides that have been damaged by free radicals. Ataxia-telangiectasia. DNA breakage repair is messed up because you got so much free radical damage. Next, with selective IgA deficiency, remember A for anaphylaxis. Anaphylaxis during any blood product transfusion, this is your #1 cause. If you get blood transfusion related anaphylaxis, what's the first step in your management, Rachel? Let's ask Kathleen. What's the first thing you ought to do, Lauren? You're getting anaphylaxis from transfusing somebody some blood. What's the first thing you ought to do? Stop the transfusion. See, you guys always think there's something more complex. Think simple. Stop the transfusion before the patient dies. Yeah, everybody goes right to epinephrine because that's what the book said. That ain't the answer. Okay, you can shoot them up with all the epi you want and blood still running in, they still die on you. Okay, stop the transfusion, then the epi. Okay, all right, that's selective IgA deficiency. Heavy chain disease is an IgA multiple myeloma of the bowel wall. So you're only gonna know, Melissa, when they biopsy the bowel wall and they tell you IgA producing plasma cells everywhere, infiltrating the wall. So you get the same malabsorption, so you can't separate it based on that. Heavy chain disease. IgA producing multiple myeloma, but it's in the bowel wall. Next one, celiac sprue. The screening test.
Excuse
Wait a
me, sir,
minute.
please.
Oh, boy, Mabel, you gotta wait, let me finish speaking. I don't see your hand up anywhere. See, that's how you forgot to put your hand up, Mabel. Make sure you put your hand up. All right, what's your question?
What did you say about selective immunoglobulin A deficiency?
I said selective IgA deficiency causes anaphylaxis during any blood product transfusion.
Okay.
All right, so celiac sprue has a screening test in newborns. What is that screening test called? Jolita.
I don't know.
All right, Olivia Spalding. Walter.
Not sure.
All right, Margaret. All right, Karan Miller.
Sorry, you said for celiac sprue. What was?
Celiac sprue. What's the screening test for a newborn?
Yeah, I'm not sure for the newborn.
All right, Mabel, do you know?
Huh? Oh yeah. Is it trans glutaminate or something like that?
She has to know her moments, man. I gotta give her credit. She has these moments. I'm like, oh my gosh, she actually picked up the clue that time. Very good. Yeah, tissue transcontaminants. Good job, girl. All right. And then if that is positive, then we check your IgA level, which is usually deficient. Then you scope them. And when you scope them, what are you gonna see in the duodenum, Gloria? Yeah, flattening of the villus border. Yeah, that's how you know you got celiac sprue. And what's the rash associated with celiac sprue, Jess? Dermatitis herpetiformis. Looks like herpes. All right, so celiac sprue. What are you allergic to? Remember, wheat protein, gliadin, gluten. So anti-gliadin, anti-gluten, anti-endomysial antibodies, all three. Any one of them can make the diagnosis. If you take gluten out of their diet, they're fine. Then there's some people who have gluten intolerance. Just so you know why there's a whole aisle of gluten-free stuff in the stores now. Because they find out, man, there's a ton of people with gluten problems. And so the stores know they can make money off of that. Yeah, because gluten intolerance says they don't have the flattening of the villus border. But if you take gluten out of their diet, all of a sudden they feel better. These are people who had chronic GI problems. Nobody could figure out what was going on. And then they took gluten out of their diet, ta-da, it's cured as gluten intolerance. Tropical sprue is the same flattening of the border, but in the ileum, rather than duodenum or jejunum. The reason why they say tropical sprue, you usually pick it up when you cruise to the Caribbean islands. So we think there's some parasite out there that causes it, but we don't know yet. But that's how I got his name, tropical sprue. Next, for necrotizing enterocolitis, Anam, you brought this up before. Neck, first of all, involves the ileum. It's relative ischemia to your ileum, and therefore seen in premature babies. It's because all the arteries have not been hooked up yet. So relative ischemia. So now you feed them, and then a few days later or a week later, all of a sudden, their stomach starts bloating. That's because the food's not moving anymore. So it doesn't start right away. After a few days, all of a sudden the gut stops moving. That's because the ileum doesn't have enough blood supply. What you do, stop all feedings. Feed them by IV. That's called TPN, total parenteral nutrition. That means feed him by IV and give the ileum a couple of weeks to heal up. It'll finish developing. Yeah, just support him until they reestablish all the blood supply. But you gotta feed them, because it's a baby, you gotta make sure they get calories, so TPN is what we use. All right, so necrotizing enterocolitis, a classic clue for them is called pneumatosis intestinalis. That means air in the bowel wall itself. Yes, sir. You only do surgery when there's necrosis. Then you have to resect the piece that's necrotic. Yeah, because I've seen a bunch of this in the NICU, premature babies, you get them every day. So neck is real common, but you only resect when there's necrosis. You do TPN until the bowel sounds return. Then there'll be surgery, right? Yep. All right, irritable bowel syndrome, I told you it had to do with stress. Remember, peristaltic discharge first, or diarrhea, sympathetic discharge second, or constipation. It's just alternating back and forth. The person's just real sensitive to stress in their lives. So that's why you try to help them deal with the stress in their lives, because that's what really causing it. Otherwise, you treat them symptomatically. Spastic colon is a diagnosis of exclusion. That means after you rule out everything else, you say, I wonder if it's spastic colon. So what we do endoscopy, colonoscopy, and then inject glucagon into the colonic wall, and that's like a spasm right in front of the camera, and they'll feel the same pain they've been complaining about. Now you know what it is. But you always rule out everything else, because this is not very common, but it is a disease state. Spastic colon, diagnosed with glucagon injection into the bowel wall. Whipple's disease, PAS positive macrophages infiltrating your ileum. Whipple's disease, PAS positive macrophages infiltrating your ileum. So all the things that you're supposed to absorb in the ileum are going to be lost. This is the only inflammatory bowel disease that is curable. Trimethoprim sulfa for 1 year actually cures it. I've never been able to track down the original article to see what the dropout rate is. Maybe 2% of people finish that article or finish that study. Because think about it, you can't even get people to take drugs for 7 days. This is 352 days. I'm telling you, probably 99% of people dropped out. But anyway, it is treatable and curable. Because at the end of the study, they found that once we stayed on Medicaid, that's it, disease was done. It's caused by a gram negative. His last name is Whipple, so they're not gonna say his name, that's too easy. But they always say there's a gram negative, you can see on biopsy. All right, that's Whipple's. Toxic megacolon is a complication of Hirschsprung's or ulcerative colitis. It means you got so much inflammation that the proximal bowel distends, and usually when it gets to more than 6 centimeters, good Lord, that thing's about to pop. Toxic megacolon, bad disease. What do? Hospitalize them immediately. Triple antibiotics immediately. You got to cover gram positive with vancomycin, gram negatives, whatever you like, and anaerobes with metronidazole or clindamycin. You got to just get ready for everything, and then take them to surgery and cut this thing out. Yeah, the antibiotics is just in case it pops before you get them up to the operating room, because most of them will die if that happens. So toxic megacolon, ischemic bowel, elderly patient, history of atrial fibrillation. Remember, the throat clots all the time. Sudden severe pain, and then bloody diarrhea to follow. Where's the infarct going to occur? How's it? In the bowel. You throw a clot. Splenic flexion. They always like to ask that. Where's the bleeding coming from? Splenic flexion. Because that's going to necrose first. But anyway, when it obviously, if it's early enough, you catch it. We already talked about peripheral vascular disease, right? Start aspirin and statins, silostazol, second. Graded exercise. Okay, that means eat smaller meals. And then surgery if necessary. As ischemic bowel. Inflammatory bowel disease, folks, are two of the most common bowel diseases, second only to gallstones. That's why I put the words here, folks. This is just memorization, but you got to know this code. If you remember, a couple of times I've asked somebody, give me 5 words to go with Crohn's. Give me 5 that goes EC. You got to know these words. Because remember, all I need is one of them, just one. To show up in the event, you already know the diagnosis. Okay? So that part is just memorization. Make sure you do it. Now, also colitis, this is important. Right down here, colon cancer risk. Remember one risk factor, 10%, but it starts at 10 years out. So that's why they say at 8 years out, start annual colonoscopy. They'd love to ask that question. When should the first colonoscopy be done? You wait about 7 or 8 years out, now start doing it every year. Any signs of dysplasia on them, total colectomy, same step. Total colectomy. Snip of the ileum, snip of the anus, gone. Pancolitis, yep. That's why they say take the whole thing out. Pablo, question.
Yes. Why is it that smoking is protective for ulcerative colitis, or do you not believe that? Do you think
Yeah,
it's
I'm not sure I believe that either. Yeah, they've said it, I've seen it a couple of times, and I'm saying, how is smoking gonna protect you from colitis? Has anybody seen?
I've seen.
What's that? I know, but how does smoking activate elastase? So, let's see, so smoking will activate the elastase, but how does that protect you from this? Yeah. Yeah, I have not been able to complete the circle on this. Karina, you know?
I have to recheck. I definitely learned about this in school.
Yeah, I just don't.
Like, we actually like looked at the like.
All right, one day we'll figure it out. Yes, yes, mesenteric ischemia is ischemic colitis, just a type of, yeah. All right, so anyway, make sure you learn these words, folks. I'm telling you, do not go in there without these words.
Excuse me, sir.
These words have got me a lot of points. Yes, who's speaking?
Mohammed. So the reason
Mohammed.
that they say smoking is good because of the nicotinic receptors, because the nicotinic receptors make you go more often.
So smoking stimulates nicotine receptors. Nicotine receptors make you go more often?
Yeah, go to the bathroom more often, so you avoid
But
yourself
nicotine
more often.
receptors are mostly sympathetic. Unless they're talking about nicotine receptors on the parasympathetic side. I
So
mean, I guess that's possible.
If I remember correctly, it was. So there's less of the inflammatory within the bowel, so there's less irritation.
Oh, I can see that.
Yeah.
So she makes a good one. I like this. So nicotine, smoking, nicotine basically constricts. That means less of the immune system who's attacking your colon can get to that area. That I can see. Okay, I like that one. Yeah. Yeah, it can always be an association. I used to fight about that for years and say they can never prove it, but it's always an association. I said that means every disease associated with breathing. You need to quit breathing so you don't get sick. All right. Anyway, but you're right. It could just be an association. All right, the GI clues. Here we go. I'm doing upper GI, lower GI bleeding, upper GI obstruction, lower GI obstruction. We're done. Here we go. Upper GI bleeding. All right. Newborn, swallow maternal blood. They love asking this because it's not the baby. It's usually mom's blood. How do you prove it? You run an APT test, APT, which detects, here we go with F. See, you put it in the vomit, it's just a little dip. And if it's positive, then it's the baby. If it's negative, it's the mom. That way you do nothing. Children, epistasis. There's nose picking. They go digging for dimes and come out with quarters. I mean, you know, children don't have any cool. I mean, they dig their finger way out there. Ah! And of course, they cause bleeding. Now, here's what it causes problem. When they start bleeding, hey, mommy, I'm bleeding. What does mommy do? The wrong thing. They hold the picture though like this and tilt them backwards. I don't know who printed that. That's the wrong thing to do. Okay? But when you do that, the blood traces their stomach. Blood is an irritant. And so it makes them vomit. And then mom sees blood everywhere. Oh my God, I got to get you to the emergency room. That's how they became number one. It's by mistake. So now we teach mothers, pinch your nose, but hold up straight ahead. Look straight ahead. It'll stop bleeding quickly. Okay? Epistasis.
They also said that posterior bleeds are deadly. If you do that, that's like you're gonna cut.
Yeah. Yep. So posterior bleeds will drain backwards into the stomach, causing more vomiting. Adults, gastritis is number one. So this is upper GI bleeding. Remember, I told you I was always going to give you the most common because that's what they want on every test question before you worry about number 2 and 3. Make sure number 1 is not on that list. All right, massive upper GI bleeding. When they say massive, look at that. For children, Meckel's. Meckel's has a rule of 2s. Peaks at age 2. 2% of children get it. 2 feet from the ileocecal valve and then 2 inches in length. So it's always a 2, 3, or 4-year-old child because it's between 2 and 4. And also they got massive upper GI bleeding.
Inches or centimeters.
Huh?
Inches or
They always say 2 inches. I don't know about 2.
centimeters.
Is it centimeters? Also, I can remember that one. Yeah. So 2 feet from the ileocecal valve, 2 centimeters in length. Yes.
You don't have to remember the 2% because it's still.
It's the 1 to 3. I know. Exactly. They always say that. I'm like, well, as long as 1 to 3, I could have guessed that. No problem. Anyway, that's Meckel's. Remember, Meckel's is the only true diverticulum. Has all 3 layers. Adults, peptic ulcer disease. This is before they realized aspirin was causing this. And of course, milk alkalies, somebody's taking too many Tums or farmers drinking too much milk to treat their ulcers. That's how we used to have so many cases of this. Now that we made people aware of this, I hardly even see any case of this now. But back in the 80s, man, we saw them every day. They were coming with massive bleeding. I mean, a lot. Lower GI bleeding now. Newborns still swallow maternal blood, just made it down to the other end. So again, dipstick, checked apt test. Does he go with F? Scope the child. Negative, do nothing. Infants, anal fissure. Most of them are 6 o'clock. That means right in the back of the anus. Infants, anal fissure. So you always take a look at the anus before you start doing anything. You see a fissure, that's where it's coming from. All you do is soften up the stools. You tell mom, add a little extra water, to soften the stools, and the baby, the fissure will heal itself. You don't have to give any medication for that. Children, polyps. Polyps in children are usually hamartomas. That means benign. But they cause a lot of bleeding, obviously. Adults, inflammatory bowel disease, number 1. And what's the most common inflammatory bowel disease in adults? Elizabeth Edouard.
Oh, I don't know.
All right, Latoria.
Crohn's?
Crohn's is most common in men and women. Very good. A lot of students tend to pick ulcerative colitis for men, not realizing you're going to see 10 Crohn's before you see 1 ulcerative colitis. Now, most of the you see is men, but it's not more numerous than Crohn's itself. All right, so anyway. Elderly, lower GI bleeding, look at that. Angiodysplasia. That's varicose veins. All of us are going to have it. So it makes sense. Normal is the most common abnormal. Okay? Number 2, diverticulosis. I already told you for adults, sigmoid. That's the location. And then cancer is number 3. And that's why you got to finger up their butt after age 40, because cancer joins the list starting at 40. So lower GI bleeding, then upper GI obstruction. Any questions so far? Just going to do obstruction now.
In that order.
Yeah.
Inches bleeding,
Mm-hmm. Yep. I put it in order for you guys. No, angiodysplasia is like varicose veins of their colon. So that means they just bleed from time to time from trauma, from stool. Yeah. Upper GI obstruction in newborns, cranial atresia. Ashley, give me a clue for cranial atresia that you've learned. Give me a clue, Melissa, cranial atresia. You're very fantastic. That's if they ask you how we got there, but that's not what I asked. Give me a clue, but you're right though. All right, Michael. Give me a clue. All right, Gloria. They turn blue when they feed. That's the best clue. Remember, they're trying to breathe through their nose, but they can't. Yeah, you put a nasal gas tube and it comes right back out. Yeah, because it can't go down. Yeah, cranial atresia. C-type esophageal atresia. Give me a clue, Sandy.
Have it in their trachea.
Yeah, but how do I know that a child even has it? What swallowing problem is this?
Feedback of,
There's a little more than just spitting up the food you're eating. Let me see what Chris said. Give me a clue. What? No, they don't turn blue. Maria, give me a clue. C-type esophageal atresia.
I believe we,
What vomiting? What kind of vomiting? When do they have vomiting?
bilious.
No, it's not bilious. You can't even get to the duodenum from here. There's a pouch. All right, Ashley. Okay, yeah, they cough and choke with feeding and milk comes up their nose. That's because they got that connection of TE fistula with it. But C-type, remember, they can't even swallow their spit. They're drooling since they were born. And they vomit the very first feeding because the feeding can't go down. And will they have a history of poly or oligodramnio or something? Yeah, polyhydramnios because they can't swallow. Duodenal atresia, give me a clue, Ida. Double bubble sign, very good. And then bilious vomiting 30 minutes after the feeding, right? All right, very good. Upper GI obstruction, 3 to 4 weeks old, pyloric stenosis. Give me a clue, Nolan. For pyloric stenosis. I'm sure vomiting after eating is not gonna get a point. All right, about this one. Projectile vomiting. Folks, be classic now. You guys gotta quit with the general stuff. I told you on the exam, they're specific. If you don't know the right word, you're gonna read all 5 answers. That's why you're gonna get lost. Had you known the right words, you go right to the answer, get out of there. As I show you guys every morning, the key word is right there. But if you don't use that word, you're not gonna see it. How much easier that question is. All right, so pyloric stenosis, olive sign, right? All right, now we're diagnosed with ultrasound. 4 to 6 months of age, achalasia, right? They can swallow milk with no problem because the hole is that small. But once you start solid, now they cough and choke. So the history makes a diagnosis. 6 months to 2 years of age, intussusception. Give me one clue. There we go. Telescope and give me one clue, Steve. Intussusception.
Current Joey Stewart.
Karen Jellis too. Ida, give me the one vasculitis with increased incidence of intussusception. HSP. All right, that's where we gotta be, folks. Gotta be on your toes. 2 years to 40 years.
Excuse me, sir.
Yes, ma'am.
Please, I'm sorry. Please, what did he say about intercession, please?
Those same keywords we did earlier, Mabel. I'm just drilling them on the same old stuff that you've heard a bunch of times. Remember, Karen jelly stool, telescoping, stacked coin appearance. Remember, these are the clue words for interception, Mabel. It's already in your notes several times. Stop trying to write it down another time.
I see.
Just listen to it and just hear it and say, oh yeah, oh yeah, oh yeah. But not that you had to write it down again. All right, so adhesions from old surgeries, #1 cause of upper GI obstruction after age 2. And then internal hernias. The most common hernia when you're born, umbilical hernia. After that, indirect inguinal hernia. Then in women, femoral hernia. Okay, but you're just going on here. All right, 2 to 40, and then after age 40, oh, I thought I did. Oh, that is. Oh, after age 40, still adhesions. Okay, I thought I did a separate slide for it. All right, anyway, lower GI obstruction now, the last series. Lower GI obstruction, first year of life, Hirschsprung's. First year of life. Remember I told you, they haven't pooped in 7 days, Hirschsprung's versus meconium ileus for CF. What's the first thing you do to diagnose Hirschsprung's? Oshni. What's that? Barrel swallow is not the first thing you're going to do. Is what that? Meconium? No, it's not that either. Maria knows it. Put them on their side, put a finger up their butt. The explosion test. Yeah, and then you do the barium, but finger DRE first. All right, so Lori James. And what syndrome has a high incidence of Hirschsprung? Justin? Gloria? Down, so if they want a syndrome, you gotta pick downs. Lower GI obstruction, 1 year to 40 years, adhesions again. Obstruction, adhesions most common. What is the most adhesogenic material? It's called blood. They did studies years ago. Just put one RBC on top of the intestine and you still got a scar. One RBC and you still got a scar. So that's why if you see a surgeon, after they finish bowel surgery, they'll wash the intestine like 7 or 8 times before they finally sew them up. That's why. They're trying to get off as many RBCs off that colon as you can. But even with that, there's still gonna be some left over. And there's still a forest scar. Yes. Huh? Yeah, most common cause of small bowel obstruction, yes. Adhesions. After age 40, adhesion is still number 1, but now you get obstipation. Obstruction from constipation. Real common in the elderly. Why so common in the elderly? 2 reasons. Number 1, muscle atrophy with age. Can't help that. And number 2, 9 out of 10 Americans don't drink enough water. It's just a double whammy. They're constipated. Digital rectal exam. Make a friend. They love you after that. I remember this is after Dr. Shah. So I get a call from my senior resident up in Cornell Carrier. I said, oh man, I said, my chance. I'm thinking, oh, it's gotta be something good. Something good. I get up there. I said, what you got? Pericarditis? MI? What we got? He said, put out some gloves. KY jelly. Lady right there, 302. She needs disinfection. Huh? What? Yeah, because I was the intern. The interns get to do these. Stick a finger in there, pull that stool out. Again, you do it on the side. That's what we do. Because once you get that log out of there, whoosh, oh, they love you after that. They think you're the best doctor in the world, man. Yeah, because I mean, they've had tummy aches and everything else because they're so constipated. Anyway, that's observation. Manual disinfection is recommended. Please don't be using a bunch of enemas. I hate those damn enemas that they do to people. Even the patient hates enemas. Okay? You know, there's a lot of enemas you can use, but please don't do them. It's better to do disinfection and then Miralax, milk and magnesium, something simple. Throw it on the top. That way it flushes things out. All right, enemas, it means you're putting a tube in somebody's butt and then you're pouring stuff in there. You know, soap suds enema, fleece enema. People don't like it. All right, diverticulitis. Already said it's sigmoid for most adults, and then cancer number 4. Any questions at all? There it is, folks. You've been empowered again. Woo, woo, woo.
Thank
Okay.
you.
Yes, Mabel, you are very welcome. All right, biostats.
So let's go home now.
Yeah, the one topic you guys always run away from.
Let's go home.
Mabel said, let's go. No. All right, Karis has a question. Quiet down, quiet down. Renal related. If a patient has renal what? Angioedema, secondary to ACE inhibitors. Okay, I got you. It's the bradykinin that are causing it, but the underlying genetic disease